Plastic surgery used to be discreet, something only rich and famous people had, and certainly not something anybody talked about. Now it's full of colorful gunslingers bragging about how many notches they have on their scalpels. It's an increasingly crowded field where pretty much anybody can call themselves a cosmetic surgeon. The cries of "pick me" get louder, and marketing is often deceptive and misleading. It's the Wild West all over again, and you, the public, are the townsfolk getting rustled and hustled. So what happened? How do we go from Marcus Welby to Dr. House? From Dr. Kildare to mediagenic Dr. Clowns in muscle scrubs? From those fun-loving surgeons in MASH whose bottom line was taking really good care of our soldiers to nip-tuck and cocaine-filled breast implants? What's next? Doctors offering a buy one, get one free? Oh no, that's right, we're already there. So what happened? Well, managed care happened. About 20 some odd years ago, managed care came on the scene and offered affordable quality health care for everybody. Well, flash forward to today, health care is less affordable than ever. And your out-of-pocket expenses are actually at an all-time high with increased deductibles and co-pays. So where does all the money go to? To the healthcare providers, right? The doctors that are treating you? Nope. I get paid roughly about half of what I was paid 20 years ago for the same surgical procedures. Doctors are working twice as hard to stay even. The bulk of the money goes to the middlemen. The CEO of Anthem Blue Cross's salary is over $13 million, thank you very much. Well, by and large, doctors are relatively smart people and are increasingly turning to alternative ways to make a living. That's why your family practice doctor wants to do your Botox, why your dermatologist wants to do your facelift, why your OBGYN wants to do your mommy makeover. Managed care has forced them to give up the jobs they were medically trained for and push them into the field of cosmetic surgery and procedures where they can make more money hustling you. The dilemma for you is, should you let them? In a future episode, I'll teach you how to choose who does what to you. But for now, let's get back to things and how it got this way. Reason number 2, the recession. Money's tight. People can't afford health insurance. Translates into less people going to the doctors. Translates into less people having semi-elective procedures like colonoscopy or hysterectomies. People worried about their jobs are not getting nipped and tucked. With a smaller financial pie out there, doctors are going to greater lengths to get your business. I saw a woman about a year ago for a tummy tuck, and by all accounts, we had agreed to have surgery together. She calls my office about 2 weeks before the procedure telling me she's going to go to another doctor because he's going to give her a six-pack. Well, I asked her, did he explain what he was going to do and how he was going to give her a six-pack? And she said, oh, he's going to do it with liposuction. And I said, did he explain to you how that's done? It's called abdominal etching. And what you do is you create layers of scar on the underside of the skin so that skin sticks down, kind of mimicking the pattern of a six-pack. And I asked her if he had also mentioned that if she gained any weight after the surgery, and let's face it, most people tend to gain weight as they get older, that the remaining fat was going to bulge through and was going to look really weird. And of course he hadn't gone into that, so fact of the matter is she wound up coming back to me and having a real operation. Desperate times bring out desperate behavior. And guess who gets stuck holding the bag? You. And lastly, let's face it, another reason things have gotten this way is because of you, the all too gullible public. You want to believe and trust that the doctors out there want what's best for you. You want to believe and trust that the doctors out there are like those good old-fashioned docs from TV. The sad fact is medicine is a business, and all too often profit margins trump patient needs. Don't believe me? Think of the last time you went to the doctor and he actually tried to talk you out of something rather than talk you into something.